Monoclonal antibodies have been a key tool in fighting COVID-19 infections. Now researchers at the UC Davis School of Medicine are creating monoclonal antibodies that they hope will fight chronic pain.
We're targeting voltage-gated sodium channel as a key transmitter of pain.
The project is funded by a $1.5 million grant from the NIH as part of its initiative titled HEAL. It stands for Helping to End Addiction Long Term. HEAL is seeking science-based solutions to the U.S. opioid crisis. People can become addicted to opioids due to chronic pain. It can lead to overdoses. Last year, there were more than 107,000 drug overdose deaths in the U.S. Researchers are using computer software to engineer complex proteins. Those proteins can fit into specific nerve cell channels to stop the transmission of pain.
What's important that in case of using recombinant antibodies as therapeutics, they can last to the efficacy for more than a month.
Animal and human testing is years away, but the new approach shows tremendous promise.
This is where we see opportunity to replace not only opioids, but some of the other commonly used pain medications in the future.